Hi, thanks for joining me for day one of this 8-day return to exercise post-concussion. We'll be covering a lot of information on exercise intolerance post-concussion, but most importantly, we'll be covering some tips for returning to exercise, how to progress, and then on our last day, we'll cover a 16-week plan that will help you get back to exercising after a concussion. So I'm Jessica Klain. I'm a physical therapist. I currently practice in the state of Colorado at my own practice, Physio, Yoga, and Wellness. I have a lot of different certifications, which means that I really approach things from a holistic, whole body perspective, not just treating the concussion or the pain aspect of what's going on, but really trying to look at how to live a happier, healthier, and more fulfilled life from all aspects. So we're going to cover a lot of information. The first couple of sessions, we're going to talk about what is exercise intolerance, what are the different symptoms, and why do they exist? And then we'll go into how to overcome some of those symptoms. What are some things that we can push through? What are things that we need to modify in order to exercise without flaring symptoms up and making you feel bad? There's a few different types of exercise programs that we'll go over. The first one is the graded exercise program, which is more of a slow and steady progression, versus an interval program, which is more of a high intensity, short burst exercise program. And then we'll cover dysautonomia and POTS, which is a similar autonomic nervous system dysfunction that can occur post-concussion. And that exercise program just looks a little bit different than the other two. On that last day, we'll put it all together into a 16-week program where ideally we take all that information together and you can go through day by day and work through the 16-week program to increase cardiovascular health and sleep quality and all those good things that come with exercising regularly. So it's important to remember that this is for informational purposes only, and this is not medical advice. If you do need some more personalized medical advice in terms of returning to exercise, please don't hesitate to contact me or find another physical therapist or occupational therapist in your area that specializes in concussions so we can get you on a good track. So mild TBI, ideally those symptoms resolve 10 to 14 days after injury. For those people that those symptoms do not resolve, it takes 6 months until we can technically diagnose post-concussion syndrome according to the World Health Organization. That doesn't mean that between 14 days and 6 months we do nothing. It's just technically that's what the post-concussion syndrome diagnosis requires, is that 6-month mark, along with 3 or more of the following symptoms. So headache, dizziness, fatigue, irritability, insomnia, difficulty in memory or concentration, and or intolerance of stress, emotion, or alcohol. The 2 most common symptoms that we see are headache and that difficulty in memory or concentration. So these are symptoms that we see a lot, but this is not an exclusive list. If your symptoms are not on this list and you have sustained mild TBI a few months ago and you're still having some trouble with life, symptoms, neck pain, different things, that doesn't necessarily mean that you don't have post-concussion syndrome. It just means that technically, as we define it by the World Health Organization, we might not classify it as that on paper, but as somebody who sees a lot of post-concussion syndrome, there's a wide variety of symptoms. So one of the things not listed on there is exercise intolerance, but I see exercise intolerance a lot, and I'm assuming if you're watching this, this is something that you are also experiencing as well. Most of my post-concussion syndrome patients at, 2 months, 6 months, or even 2 years, exercise intolerance is usually part of a quality of life issue at that point. And it is technically defined as an increase in symptoms with increase in exertion or heart rate. So sometimes that might just mean walking up a couple flights of stairs. It doesn't necessarily mean going for a run or a bike ride. So another way to define exercise intolerance is if you have brand new symptoms during exercise, meaning that you only have those symptoms while you are exercising. So really, exercise intolerance is you can't exercise because your symptoms get to be too much, whatever those symptoms may be. So the physiology of exercise intolerance, there is a lot going on that causes exercise intolerance. One of the main things is because there's a disruption of the autonomic nervous system and how it talks to the cardiovascular system. Cardiovascular system being your heart and your blood vessels. So there is a dysfunction in how the blood flow and the carbon dioxide is being measured and being monitored by these two systems while you're exercising. And because those are not being able to be monitored properly, it creates a disturbance in the blood flow and a disturbance in the carbon dioxide, and that contributes to your symptoms. Because of that, we see differences in heart rate and systolic blood pressure with exercise in people with concussion versus people that don't have concussion. So all of those foundational body functions that are disrupted with exercise in post-concussion will create some form of exercise intolerance. Another component of exercise intolerance is vestibular and vision problems. So we know that vestibular and visual issues are very common post-concussion, and that affects us specifically when we're doing more difficult movements or exercises. So if we think about doing yoga and we're transitioning from downward dog to upward dog, that's a big visual vestibular input that can create a lot of symptoms. Or even thinking about walking or running on a treadmill, that's a very difficult vestibular input because we're walking or running forward, and so our brain kind of thinks that we should be moving through space, but because we're on a treadmill, we're actually not moving through space. And so that can be a really confusing sensory input. Another component is cerebro-autoregulation. So this is related to the first point of the autonomic nervous system dysfunction, where our body, our cerebral vasculature, the blood vessels in our brain are having a hard time stabilizing the blood flow as the blood pressure changes with exercises. And that has a lot to do with that autonomic nervous system being able to respond to the changes that are occurring during exercise. And if the autonomic nervous system doesn't respond appropriately or quickly enough, it can give us symptoms. Other components are an inflammatory process. In a previous lecture, I talked in depth about the metabolic cascade of changes with the neurotransmitters, and that can contribute to exercise intolerance as well. And then we have the actual injury itself, the axonal disruption related to a concussion. So it's the inability of the nerves to talk to each other in the same way that they were prior to the concussion. So when we don't have good networks of information, that doesn't allow our body to respond to exercise the way that it should. So what do we actually find in the clinic or symptom-wise in your life? So the first key is that we have an increase in symptoms with exertion. So I mentioned this before. It's either an increase in your baseline symptoms, meaning what are your symptoms when you're just sitting there? So you show an increase in perhaps headache or dizziness or lightheadedness when you exercise. Or you have a brand new symptom onset with exercise. Sometimes this could be like a sharp stabbing headache that feels totally different. Sometimes it could be like excessive sweating. Sometimes it could be feeling like your heartbeat is really, really strong and it feels really uncomfortable. Either way, the key is that your symptoms are the limiting factor of the exercise. It's not because you're out of breath. It's not because your ankle hurts. Exercise intolerance is technically defined as you are limited in exercise because of your symptoms. Then this one gets a little tricky in terms of sometimes the symptoms don't occur during exercise. Sometimes they occur after, and that makes exercise program a little bit harder, but that still is exercise intolerance. So the second key is that different exercises may produce different types of symptoms. So we see a lot of different categories of post-concussion syndrome symptoms. So right now we're talking about exercise intolerance, but just because you have exercise intolerance doesn't mean you don't also have cervicogenic pain or dizziness or a vestibular hypofunction or a VOR dysfunction. So we do have to pay attention to all those other things that are going on as we return to exercise. And we do that by considering the environment that you're in, if it's loud, lots of people, the lights, the carpet, the sunshine, all of that, different body positions, movement and speed requirements. So it's a little bit of a puzzle when we talk about the exercise intolerance and how we are going to overcome that for you specifically to give you the best ability to exercise without provoking symptoms. So a couple months ago, I did a full lecture on the Buffalo Concussion Treadmill Test. This is our most objective test to determine exercise intolerance. It's a very specific walking test on the treadmill where you increase your percent incline every single minute to increase the intensity of your effort to determine how your heart rate and how your symptoms respond. And then we determine what your heart rate threshold is based on that information in order to develop a specific exercise program for you that stays under that threshold of symptoms. So one of the questions I get a lot is, when should you start to exercise after a concussion? And this information has changed over the last decade, but now we know that starting light exercise within 3 to 5 days after a concussion is really, really great for the healing process. Prior to that 3 to 5 days, rest is important. Now, it's important to know that at 3 to 5 days, you're probably not going to want to exercise. And how we define exercise, it's really just going for a walk. It's not this big, huge exercise event. You might not even sweat, but it's the process of getting your blood flowing that can really help the healing process. So one of the most important things is that we want to minimize the risk for having a second concussion. So this usually means non-contact sports or even reducing, bike riding where you could fall off and hit your head. And the exercise level is extremely low compared to pre-concussion level. I usually start people out at that 10 to 20% and build from there, just so we can get out and do something, but ideally not really elevate those symptoms too much. Now, most of you are probably more than 3 to 5 days out of a concussion, and maybe you haven't exercised at all, but we know that it's never too late to start exercising. So just because you haven't done it so far doesn't mean that you can't start. We still have lots to gain through exercise. So lots of benefits, both for just overall healthy living, but also specific to the post-concussion brain. So when we exercise post-concussion, we see a decrease in symptoms sooner. We see an improvement in sleep, improvement in mental health, including decreasing anxiety and depression. And we also see an improvement in academics and cognitive performance. So all signs point to exercise as being good post-concussion. So that covers what we're going to talk about today. Over the next 7 sessions, we're going to cover all these other topics in terms of getting back to exercise, how to do it, different programs, and then again, we'll put it all together on day 8 in that 16-week program. So if you have any questions, that was that last slide. Feel free to email me, find me on Instagram, visit my website. I am happy to answer any questions today, at the end of the 8 days, or months from now. Please don't hesitate to reach out. And then for anyone that wants to get more into the science of it, here are some references, and there's lots more articles. So if you ever want more reading material, please don't hesitate to ask. So that concludes day 1, and I will see you soon for day 2.